Hello and welcome to today's presentation, Empowered Veterinary Nursing for Today and Tomorrow. Today's webinar is being presented by Virox Animal Health, makers of Rescue, and our friends at Fear Free. Before we get started, we do have a very exciting announcement we wanted to share with all of you. Virox and NAVTA recently launched their Infection Prevention Leader program. The course is available online, completely free. We'll put the link in the chat for you to access it. And it is, if you complete this course, you'll receive up to 5 CE credits. So before we get started, we do have a couple housekeeping items to go over. There will be a live Q&A at the end of this presentation. So send in your questions at any time in the chat section located on the right-hand side of your screen. We also want to hear from you today, so keep an eye out for some polls. And without any further ado, I would now like to introduce our presenter, Angela Logsdon, Regional Technician Director at BCA Animal Hospitals. Over to you.
Hi, everybody. This is a topic that I'm super excited to present to you guys today. I'm very passionate about this particular topic. And so hopefully you guys will learn a little bit. And if you guys have questions or anything, please, like Laura said, jot them down so that we can answer those. I do not have any conflicts of interest that will affect this talk today. And to get started, we're going to go ahead and jump in with a poll. So I've got 3 questions there that she's going to put into the chat there for us. So if you guys can just take a few minutes, this will really help us as we move on through the talk. Do you feel that you guys are being utilized well in your hospitals? Are you getting to use all of the skills that you got to learn in school? Are you satisfied with your role within your hospital? And then what do you think might be the primary barriers for folks to not get to use those skills within their hospitals? And I put 3 choices in there. If you guys can go ahead and select that. I'm going to give you guys just a few minutes to do that, and then we'll move on. Next poll is up. So this is where you're going to answer the question, are you fully satisfied in your role within your hospital? Oh, and the third question must be live because I'm getting an A, B, and C answer. Awesome. Well, Sharon says she has an alternate answer for question 3. I'll be interested to hear what that is later on. All right, does it look like we're moving through?
The results are all in, so we're good to keep going.
Cool. All right, so I'm going to share a bunch of data with you guys here at the beginning, and then we'll go into the main portion of the talk. So some statistics that I wanted to share with you guys. JAVMA shared in 2020 that by 2030, 20% of the current veterinarians are set to retire. That's a lot, right? And by 2030, the number of veterinarians coming into veterinary medicine is only set to go up by about 2.2%. So pretty significant decrease that we're looking at in less than 10 years coming up. In 2019, AVMA shared that by adding one veterinarian to your hospital, you can increase revenue to your hospital by 6.3%, but adding a credentialed technician can increase revenue by 18.3%. 3 times the amount of revenue can come into our hospitals by having a credentialed technician. And then if we look at the AVMA survey that was done in 2008, the average increase gross revenue to our hospitals per credentialed technician was nearly $162,000. And then in 2020, they kind of recomputed that number to figure for inflation and all of that kind of thing. And they got the number of $220,000. So that shows that we have significant value to our hospitals as credentialed technicians. A study in 2010 done by JAVMA looked at whether a relationship existed between veterinary practice revenue and the characteristics of veterinary technicians, including their education level and qualifications. The results showed that the typical veterinarian, so this is the individual doctor's income, increased by $93,000 for each technician that they had in their practice. That's pretty significant. And they equated these numbers to the leveraging of the technicians within their hospitals. So allowing those technicians to do the skills that they were trained to do and letting the doctors stick with the doctor things, right? Not having to be directly overseeing everything that those technicians were doing anymore. So here's where our poll answers are going to come in. I wanted to see what your answers were compared to the NAVDA demographic survey that was done in 2022 and was released just this January. So what did we get?
We have some interesting results, actually. So when we asked, do you feel you're using all of your skills? 25% said yes, and 75% said no.
Wow.
And then when we asked, are you satisfied in your role? 60% said yes, and 40% said no. And then finally, when we asked, what do you think is the primary barrier to techs using their skills? 27% said lack of trust, 38% said training, 34% said DVM won't allow, and then we had a few people in the chat who actually said all of the above.
Yeah. So, wow, right? Wow. Yes. Those barriers there make up nationally 50% of the reasons that our technicians are not being able to utilize their skills. And I'm really sad to see that this population in particular, that makes up a lot more than what our national answers came out to be. And that 75% saying no, they're not being utilized, that makes my heart super sad. And not being satisfied, 40%, that's such a significant number to be not satisfied. So I'm hoping as we move through today, this talk, you guys will pick up some pieces that will help you to move forward in a positive way and truly make this career your own. Thank you. All right. So we're going to look at one more screen here with some more information. I pulled this from the Veterinary Nurse Initiative. I'm sure you guys are familiar with. And if you look to the left, on the far left side there, you can see these are tasks that are not utilizing much of the skills that we learn in tech school, right? And then you look on the far right, and those folks under the high category would be utilizing all of the skills that they learned in school, maybe then some, right? And the folks that are not being utilized well, which sounds like about 75% of you guys, tend to be feeling like they're not challenged, feeling like they're not trusted. They're doing just whatever they've been told versus feeling like they can think on their own and make decisions for their own. Folks in that category typically also have low morale, and they see this as just a job, right? We come to work, we do our job. Yeah, we get to work with animals, but it's just a job. And when we get to use our skills to the most, we feel like we have more autonomy, we have empowerment, there's trust both ways, both the team having trust in us, but then also us having trust in our leadership team. There's more of a collaboration within the hospital. We get to utilize our critical thinking skills. We get to become part of the leadership team. And we tend to look at veterinary medicine and being a credentialed technician as a profession, as a career, versus just a job that we go to every day. So that was a lot of information, right? What does it all mean? It means that being a veterinary technician in this world today is hugely important, right? It is so significant for our teams, for ourselves, for the patients that we take care of, that our technicians are empowered to work at the very top of their licenses. We will end up having better patient care in our hospitals. We will get to see more patients on the floor each and every day because we won't be limited by the number of doctors that are there. This will increase the revenue, not only to our hospital, but in turn to our doctors, and then in turn to ourselves, right? The more we're able to do and the more revenue we bring into our hospitals, the more we'll be able to get paid. And then, like we mentioned before, that job satisfaction and making sure that you guys are able to consider this a career and not just a job that you're passing through. This is your journey, and I want you guys to enjoy it. I love this career. I think that this is the best possible place to be. Veterinary medicine is amazing, and I hope that by the end of this talk, if you don't already feel that way, that you will feel that way. This is like a choose your own adventure book. I don't know if any of you guys are old enough to remember the choose your own adventure books, but that's what this career truly can be. There's not one roadmap that you have to follow. There are many different paths, and you guys just need to be able to reach out and find what that is for yourselves. The typical life of a credentialed technician is somewhere between 5 and 7 years, and that number has not changed in over 20 years, probably more than that. I just know that when I was in tech school, those are the numbers that they were sharing with us. And today, that is still the number, so potentially even longer, which breaks my heart. So how do we start this journey? How do you kind of create your own roadmap, so to speak? What are you passionate about? Okay, I'm going to ask you guys a few different questions, and I hope that you jot them down and really take them to heart. If you're not able to think about those answers in this moment, that potentially you'll think about those answers a little later today or next week, or whenever you have some downtime. What is your passion? Are you passionate about dentistry? Are you passionate about nutrition? Are you passionate about maybe ultrasound and advanced imaging? What do you love about veterinary nursing? When you're at work and you're working on the floor, what are the things that excite you, that bring joy into your life? Is it surgery? Is it client education? Do you just absolutely love going into a room with a client that's never had a cat before, and they have this beautiful new kitten, and you get to help set them up for success? Do you enjoy senior patients, right? Where you get to truly impact their last days of life? How do we make this pet the most comfortable that we can? And that's a passion for some. What about client education? Just really helping clients to truly empower them and how they can be the best possible owners for their patients or their pets. And then, do you know what all of your options are? Do you even know what those choices are? I think VTS is getting more and more out in the world these days, and so it's more known. That's one path, right? I remember several years ago, it felt like the only path a technician could see off of the floor was to step into management, become a hospital manager. And that's not necessarily the case. For some, that is a passion and that is something that they want to go into, but it's not something that you absolutely have to go into. And then finally, what is it that you feel you need to be at your absolute natural best? Is there a particular training? Is there some mentorship? What does that look like for you? And does your hospital have a culture of safety and learning to foster you growing in this journey that you're looking forward to. So as you guys kind of take note of those questions and kind of do some soul searching and figuring out what your answers to those would be, I figured I would do something I have not done before, and that is to share a little bit of my story, my journey. I felt that it was very suited for this particular topic. So when I was about 16 years old, I got my first real job in a veterinary hospital, right? Many of us have a similar beginning. I was picking up poop. I was walking dogs after school, cleaning cages, and I could not believe that I got paid to do it. It was the coolest thing ever. I would work for 2 or 3 hours after school every day and just really enjoyed every moment of it. Over time, I started to do more veterinary assistant jobs, restraining patients, and things like that. I helped the CSRs, and I absolutely fell in love with veterinary medicine. I thought, I'm going to be an engineer. I'm going to go into engineering, and that's what I was going to do. I was already taking classes in high school to prep for that. And through the couple of years in high school that I was doing this job, I totally changed my mind and then decided to go into veterinary medicine. So right out of high school, I went into tech school. And while I was there, towards the end of my education, I went in to do my final externship that I decided was going to be with a large animal farmer who did some, or veterinarian who did some small animal in his clinic. Lots of farm calls, lots of cattle. I just absolutely love cattle. And we would go on these farm calls, and I would constantly be asking, hey, what can I do? How can I help? How can I, X, Y, Z? And he told me, just stand there and look pretty. And I was appalled. How could you possibly tell me to just stand there and look pretty? I am here to learn and grow. I want to touch these animals. I want to do the things, right? And so professionally, I persisted, and he and I ended up developing a wonderful relationship. I got to do all kinds of very, very cool things on the farms. It was February and March, so very, very cold here in Michigan. And I went to northern Michigan. And I don't honestly remember my cold toes. I just remember what a blast I had working with all those cows. Once I graduated, then I went on, I stayed in my general practice for a while, and I came to be the lead technician, lead trainer within the hospital. And after a couple of years, I decided I wanted more. This is not enough still. I wanted to grow, and I reached out to the specialty and emergency hospital that we used for all of our specialty and emergency referrals, and thought, maybe I'll just work a couple days a week and learn and grow my skills. I ended up taking on that job full time, and I loved every minute of it. I worked primarily in the surgery service. I got to do all kinds of cool things while I was there. I got to work in neurology. I got to work in emergency. I got to work in internal medicine, ophthalmology. I discovered I don't really care for ophthalmology, but I did do a stint with them as well. I picked up shifts, and it was an amazing experience. I knew that I could walk down the hall at any given moment and learn something new. It was very, very cool. And so you might say, Angie, you're lucky. You're just lucky. Maybe I was a little lucky, but I made those things happen. I persisted, I knew what I wanted, and I went for it. And while I was there, I got to experience so many cool things. I got to hold many positions within the surgery service itself. I became the veterinary relations coordinator, so I got to do training and education between our specialty hospital and the general practices around. It was just a really, really, really cool experience. So now, fast forward a few years later, and today I have been in veterinary medicine for 27 years. I have been a licensed veterinary technician for 20, and I am working as a regional technician director for VCA. I oversee training and development for technicians and assistants throughout 55 hospitals in the Midwest. And I can't even believe that I'm here. right? I look back over my journey, and even 10 years ago, I wouldn't have seen myself in this very amazing, cool place. I get to help develop others and help them to find their journey and their path. And my why over the years has shifted into just this, helping you all find your journey and your path. I'm here because I decided that day that that doctor said, just stand there and look pretty, that I was not going to just stand by and look pretty. I was going to forge my future on my own, and I was going to make sure that I was satisfied. So the lesson is don't stand by and look pretty, right? Open your eyes and look for those opportunities. So now that you guys have had a moment, as I talked about my journey, to really think about your own, I'm hoping that if you didn't take that time to jot some notes down, that you will. And let's talk about, how do you get there? How do you create this journey for yourself, right? So I think the first step is to answer those questions and figure out, where is it that you want to go? And then we need to figure out, how do we get there, right? No matter where you started or where you're at right now, your journey doesn't have to end. At any point in time, you can change the trajectory of where you're going and have a really rewarding career in veterinary medicine. There's a saying that has probably been around forever, and that is, dress for the job you want and not the job that you have. Now, if your goal is to become a hospital manager, I don't expect that you would go into your hospital working as a technician wearing dress clothes or business clothes. You're going to come in wearing your scrubs, right? Because that's the role that you need to play. What you can do, though, is come in with clean, non-wrinkled scrubs, hair brushed, clean, all of those kinds of things. So dress for the job that you want, right? Make sure that you're setting yourself up for success. Other things, we need to think like a business owner. We need to think ahead and be proactive. And then we need to create a plan, and then in turn, a proposal for our hospital leadership, if that's where this is going to take us, right? All right, what does it mean to think like a business owner? Take a vested interest in the success of the business, right? It's hugely important. I would love to say that we all work in a nonprofit and we're just doing good all the time, but it takes money to run these businesses. It takes money to pay the associates that work in these businesses, right? And so if we are able to really understand the true value of what it is that we're offering to our patients and our clients, we will then in turn be able to convey that value to our clients and get better compliance. I think it's very easy for us as technicians and assistants to walk into a room with a client and already be price sensitive to a treatment plan that we want to present. And we sometimes will go in a little bit jaded, and that can be noticed by the owners in the exam rooms. And when they don't have confidence in you presenting that treatment plan, they're not going to say yes as often. So we need to think about, yes, there is an expense associated with the lab work that we want to do or the radiographs that we want to do, but what is the value that we are going to be conveying? Why do we need these things to be done? Think about expenses, right? Labor, the amount that the hospital has to pay to each and every person that works in the hospital, the supplies that we're using. So let's not be wasteful on our supplies. If you have anything to do with ordering supplies, as many technicians do, you can look at different deals, maybe a different supplier, maybe a different product that might be more reasonable. And then when you have things in, make sure again that you're being very responsible with those things. Just for instance, if you hired someone to come do some work on your house and you agreed to pay them for 10 hours of work, and the day shows up and it's time for them to be there and they show up half an hour, 45 minutes late, then you notice that they're doing a lot of standing around, chit-chatting, not really doing the work that they were there to do. And then they leave early. Are you going to feel good about paying them for the 10 hours that you had agreed? Probably not. going to be happy about that, right? And so it's just kind of a way to personalize what that think like a business owner mentality looks like. So then the next piece, thinking ahead and being proactive. So in your day-to-day, try to be as efficient as you can. One of the really cool things that we have for cleaning exam rooms are the rescue disinfectant wipes. You can clean the entire room, exam room, with just the one wipe. It can really expedite that process and can move along your day a lot quicker. Make good use of your time and your efforts. So making sure that you're doing the things that you can excel at, that you're not struggling along with something, unless it's something that you're truly learning and there's been set aside time, right, for you to learn something with a mentor. But make sure that you're doing the things that you know that you can do, right, and not overstepping those bounds. Bring new ideas to your hospital leadership, things that you see as an ability to function more smoothly, more effectively, more efficiently. Maybe you notice that there's a lot of flow issues because the printer is in a particular place and people have to keep walking to that printer and getting in the way of treatments for patients or whatever, right? If you guys have heard about the spaghetti diagram, sometimes you have people zigzagging and walking all over the place, and really all that would make the difference is moving a printer or moving a piece of lab equipment, moving the centrifuge, right, to help make flow a little bit better. Think about things, maybe, you know, the way you guys do discharges in your hospital would be a little bit easier if you came up with this really cool idea. Maybe we schedule them this way. How do we, you know, go through those things? Learn as much as you can about the needs for your patients and for the doctors that you're working with, and be proactive in thinking about what is it that they're going to need. Try to anticipate what those needs are. When I was working in surgery and I was the assistant to the surgeon, scrubbed in, it was imperative that I paid very close attention to my surgeon so that I could get whatever the next thing he needed right to him immediately, so that that patient was under anesthesia least amount that was possible, right? So that's just one example there, but trying to anticipate what those needs will be for appointments even. Are they going to need lab work on this sick pet? Are they going to need to take x-rays? Maybe we can go ahead and log the patient information in, right? And then share knowledge with your teammates. So you have this idea of a journey that you want to go down. Maybe you want to take on ultrasounds. You want to learn how to run ultrasounds on your own and create this service within your hospital. But in order to do that, you have to let go of some of the other things that you're doing in the hospital. Don't hoard the knowledge, don't hoard information, share it liberally. And when it comes time for you to step into a new role, your leadership is going to be more apt to give you that opportunity when they know that they don't have to backfill your position, that somebody's already there ready to go. I would hate to say that someone would hold you back just because the role that you're currently in doesn't have a backfill role. However, it does happen every day. And so we want to try to prevent that from happening. All right, so this is the roadmap, right? How do we create the proposal and plan to move forward and whatever this journey is going to look like for you? Come to the table prepared. Do your research. And as you're brainstorming and creating this plan and this journey for yourself, think about what is it that you want, okay? What is the goal that you have in mind? And then also include statistics from the research that you've done, right? Be able to provide value. And your leadership team will be able to look at that and see this person is very serious about this. They've done their homework. They understand what is involved from all sides, and they're going to be more apt to give you those opportunities. So I'm not going to spend a lot of time reading through each of these, but you guys will be receiving this PowerPoint and you'll be able to read through these letters later on. These are just some examples of letters of intent. So I've got 2 of them here for you to review from individuals that applied for some positions that I had open on my team. And I thought that they were really well written. And both of these individuals got the job, got the role. And it didn't take them out of their hospital. It is an added role that they added to their already busyness, but it is leading the way for them to take on a role such as mine. So good examples. So what does it look like to create that proposal? So the introduction. And I don't know if anybody, I don't know if they have the ability to unmute or maybe even just jot some things down in the chat, but I would be happy to make this more tailored to someone that maybe already knows what it is that they want to do. When you're in your introduction, make sure that it's catchy, right? Imagine what it would be like if we didn't have to say no when clients called up with an urgent sick patient. What if we XYZ? What is the problem that you see? Well, in this particular instance, if we're turning patients away, we can't see them, then maybe the problem statement is that we're turning away X number of patients a week because we just don't have the appointment slots available, right? And then lay out your solution. What is your plan? What is the data? What are the expenses involved? So one topic that I know in the hospitals I support that's been very popular lately is technicians really wanting to move forward in diagnostic imaging, particularly ultrasound. They want to get more training in ultrasound so that they can run those scans. They end up running their own column in their hospitals. They have the patients come in, they do the ultrasounds, they send them out to AIS for review by the radiologist. The results come into the doctor, and the doctor is able to communicate with the client. And the doctor is not involved in that actual ultrasound appointment. But there's an expense with that, right? They have to go away to have this training done so that they can do a good job. So that would be the piece of the expense there. This is going to cost, $1,000, or this is going to cost, the hospital XYZ dollars. And the return on investment is, so that's what that ROI, the return on investment will be after this many ultrasounds, we've made that money back. I will be able to add this much money to our bottom line, and so on and so forth. So make sure that you lay that plan out for them. Also, it is very important that you do not become so married to the plan that you have in your head that you're not willing to listen to the ideas from the leadership in your hospital, right? So they may say, hey, this sounds like a great idea. However, I'm not sure about this particular pathway to get there. Maybe we can take this way to get there, or maybe the timeline might be slightly different. So be very respectful when you're sharing your plan with your hospital leadership, and then bring it all to a conclusion, right? In closing, XYZ. And so I'm hoping when you guys have the opportunity to read through those letters, you'll see kind of how they brought that together at the end. Okay, so you've put together your proposal, you've got your plan, you're ready, you've presented this to your hospital leadership, and they said, yes, let's do this, right? How do we get there? We need to set up goals for ourselves, right? And SMART goals, probably everybody has heard about SMART goals. They need to be specific, so very clear on what it is that we're looking to do. They need to be measurable. We need to be able to see that we're attaining that goal. They need to be actionable, realistic. So one example that I would say for this is you want to go do a marathon. And if the marathon is in 2 months, is that realistic? No, it's not. If you've never been a runner before, it would not be realistic for you to then just, 2 months later, join a marathon. But if the marathon is in 6 or 12 months, you can set up realistic goals and activities to get to the point that you can do that marathon, right? And then time bound. Make sure that you set the time frame in there, particularly when you're dealing with a hospital that has to pay attention to expenses and return on investment. We want to make sure that we set up dates, tentative dates, solid dates to be able to reach those goals. Never, ever, ever settle for this is just as far as I can go. This is it. Don't just sit back and look pretty. Don't feel like you have to leave veterinary medicine just because you're maybe getting older and can't see yourself, wrestling a dog on the floor at 60. Don't think that, you have to become a hospital manager if that's not truly your passion in life. If it is your passion in life, I really hope you do go for it. But if it's not, think about all the other cool opportunities that you have. And I see someone put in the chat, crucial conversations. Yes. So I wanted to provide some additional resources for you guys if you are thinking about how you navigate the conversations with your hospital managers, medical directors, whoever's leading your hospitals. How do you have those conversations with them? And Crucial Conversations, as well as Emotional Intelligence, are two books that have changed my life, not only professionally, but also personally, how I engage in conversations with folks. If you want more books, there's tons of really cool books out there to help you move forward. So if anybody is interested in what other books might help them along their way, then please, please, please let me know and I will help you out. Here's my email address, contact information if you guys do decide after today that you have questions, if you want to find out what some other books or resources might be, or hey, I don't know where to start. Can you help me figure out what this path would potentially look like for me, right? Then I'm happy to have you guys reach out. And without further ado, I am going to turn it over to Laura. So if there's questions.
Yes, well, thank you. That was a great presentation. It's always really fun to see the audience engage. So thank you, everybody, for putting your comments and in feedback in the chat. That was great to see. Now, we didn't get a lot of questions, but we did get an interesting point from Sharon, who was talking about vets in her area. And Sharon was saying vets in my area tend to be from general practice and are still of the mindset that technicians are animal holders, which is also something that was echoed by a few people in the chat. And in Sharon's experience, they don't attend national or international CE events and they aren't necessarily up to date on the most recent advances. So do you have any advice for anybody who's struggling with vets who they feel are stuck in the past?
Yeah, absolutely. This is kind of funny to me because this is that cattle doctor that that I worked with, right? He was
Absolutely.
older. Yeah, all of those things. And I think what really works the best in those situations is to just educate them, right? So you need to be professional in the way that you're approaching it. You can't just bully them over, well, I can do this and I learned this in school. But the educational piece can really, really help, right? And I think if you go back to those numbers, right, you'll get this presentation with the resources on there where you can find those documents. The numbers don't lie. And I don't care how long they've been in veterinary medicine, who doesn't want to make an extra $100,000, right? I mean, just talking to the doctor himself, right? Making an additional $100,000 a year because they start allowing technicians to do things. Yeah, education is the first place that I would start. It's just helping them to understand in a very professional way these really cool things that you are very well and capable to do. And then Don't stop asking. Don't stop asking. I can do that. Can I do that for you? I can help you with it, right?
Yeah, that's great. Great advice. Now, it doesn't look like we have too many other questions coming up in the chat. It was nice to see everybody sharing, the areas they're most passionate about. So that was a lot of fun there. But we do have your contact details here if anybody wants to reach out to you directly. And if we don't have any further questions coming in, I guess I'll give them a couple seconds here, but it looks like this would be a good place to wrap up. Oh, it looks like Sharon says that's what I've been doing. I so good. That's good to see that Sharon's already working on it.
Explain what a VTS is. Yeah, yeah. That can be frustrating, and especially if the entire area is permeated with that style of veterinarian, right? However, come the next 7-ish years, those doctors are going to be retiring, right? And we'll have the newer ones coming in, and those newer doctors, they lean on us way more, way more. That's what they're coming out used to, which is they don't have a choice, right? They really don't, because there's too many patients for them to see on their own.
Oh, we just had a few questions jump in here. So one is from Michelle, who says, I am in vet school, but not in practice. So I will only have experience through my school internships when I apply for a job. What should I look for in a hospital to get the best training? And what questions do I ask during an interview? Those are great questions.
I love this question because we do a lot of new grad hiring, and internships and externships and all of those things. And honestly, the hospitals that tend to do the best medicine and best patient care are the ones that are utilizing their technicians the most. And if you dig a little deeper into some of that, the resources that I shared, you will find that the technicians are the ones that are really working with those patients. They pick up on, pain and illness issues, medication reactions, all of those things. So one of the big questions I would ask for sure is, how do you utilize your technicians and assistants in the hospital? And if they say that they go into the room and get histories and restrain them while they're giving vaccines, like, I'd probably bypass those ones. But if they're saying, listen, the technician directs me throughout the day and helps me stay on task with my patients, they are running all the lab work, they're managing my surgery schedule, those are the ones that I would for sure look for.
That's great advice. And this actually segues great into a couple questions that we've had along the same lines. Okay. Now, one individual has gaps in their resume and is asking, how do I present myself to a potential employer and feel confident with myself with little practical experience, especially if I want to apply for a position that I'm passionate about, which also ties in well to another question that we had for looking for advice for people who are just starting out and looking to get their foot in the door.
Yeah. I guess I'm not sure what the gaps in the resume would be. Is it gaps of employment history potentially? I guess that kind of depends, but just getting your foot into the door, soak it all up. Be very curious, right? Don't go in like you're going to take over the world and asking a bajillion questions, right? But have your eyes and ears open and be curious. Be curious with your eyes, your ears, and ask the questions, right? Pay attention to what's going on. And if you have a question, be very mindful of when you ask those questions, right? If somebody's really struggling with a very nervous cat and drawing blood, that's probably not the moment to ask them the question. But a little later, they're going to appreciate so much that you are asking the question. Hey, I noticed that cat was XYZ, and can you tell me a little bit about how you were able to go ahead and I would have been so scared, right? Like, ask those questions, be curious. That is the best possible thing you can do. And then just soak it all up. The other piece I would really encourage is take the constructive criticism well. It can be really hard sometimes. I remember the first time that I got constructive feedback when I was the kennel person walking dogs, right? And I was just very cautious and a very nervous type. I want to make sure that I do well, right? And I didn't want to step on anybody's toes or step out of line of my job. And the piece of constructive criticism I got from my hospital manager was, you've been here long enough. You know what you're doing. Take the initiative and do it. And I was like, oh, I got a pass to like do these things that I really wanted to do anyway. And it was hard to hear because I felt like, oh, but I wasn't meeting their expectations, right? Breathe. Don't take it like it's a true criticism. It is truly there to help you grow. How can I take this constructive criticism in and move forward on a positive foot and grow my career in what it is that I want to do. If you're truly passionate about this, don't let those little things crush you. Keep moving forward.
That can be very tough to hear. I can relate to that one. But that actually does segue well into a follow-up from Melissa, who looks like she may also have to have a tough conversation because as a vet tech, the hospital that Melissa is at is giving her so much to do and utilize her license and skills, but it's getting to be too much task wise. And her managers and doctors don't realize or understand that she can't be in multiple places at once. So do you have any advice for Melissa on how she should handle that?
Yes. So it sounds, I'm getting out of that you're probably somewhat of a leadership role in your hospital, maybe a head technician or technician supervisor, something along those lines. They truly appreciate you and the job that you do. You're probably very reliable. I would recommend a book called Boundaries for Leaders, or Boundaries in Leadership, I think it might be called. And it helps you to understand how to set healthy boundaries for yourself within work and how to empower others, right? So this is where that mentorship to someone lower can really help. What can you delegate off? Maybe you're going to oversee that the task gets done. Maybe it's the safety coordinator, right? Maybe there's someone who's really interested in this program that Laura shared at the beginning, right? And they're going to take this on, and that's going to be their thing. And they really want to, be all about the safety, right? And, PPE and all of that, right? You can oversee that all those tasks are getting done, that the PPE is being examined every 6 months or whatever your protocol says, that, the proper disinfecting protocols are being handled. But you can delegate the actual tasks to someone else. I hope that helps.
Yes, and if anybody was looking for the link to that program that we were referencing there, the Infection Prevention Leader Program, the link is in the chat. So you can access it that way if you'd like, and it'll be in the follow-up email as well. Now, we had a very interesting question come in. Do you have any advice for new RVTs dealing with imposter syndrome?
I see that. I think I deal with this even today. Who am I? Who am I to be telling anybody anything about these things, right? It can be challenging. And so I'm not going to tell you that it's something you will completely ever get over, because I personally have not. What I will tell you is I think it's a sign that you're going to be a really great patient advocate in your career, because you're concerned about doing what is right. And I think that you are going to make a fantastic technician, right? You need to be concerned. You need to have a healthy respect, but not a fear. So reframe the fears that you have about making mistakes and all of those things. I promise you, you will make a mistake. Every single one of us makes a mistake. And when you make that mistake and you learn from it, you won't make the same mistake again, right? You're going to learn from it and you're going to do better. So when you make that first mistake, don't let it destroy you. You're going to feel sad, especially if it affected a patient's life, right? You're going to feel sad. You're going to feel down. Process it, grieve over it, and do better next time. You can do it. There are some, I wish I could remember the references off the top of my head right now, but there are some really, really great resources out there about imposter syndrome. And I mean, feel free to email me later and I will find those resources and send them over to you. But imposter syndrome, it is real. It is real. I struggle with it as well. And just knowing that it helps you to be a better technician, hopefully you take that and realize that it's okay to be nervous. It's okay to be respectful of those things, but don't be afraid. I don't know. I feel like I rambled on that one.
I thought it was great. It was a great answer. And then we do have a couple more questions, actually. One is it came in from somebody from Canada, actually. I have a passion for rehabilitation, but there is limited resources in Canada. What steps can I take to get more credentials to elaborate on the skills I have already learned? And they did go on to say, I did implement a physio program at my old practice, but with my new practice, I feel like I need to educate myself and reevaluate how I'm going to implement this service.
Yeah. So I would say, the investment in the equipment to do true physical therapy with the underwater treadmill and all that, that can be very pricey, right? So if this were myself going through this, I would first invest in the educational piece. What is it that you need to learn in order to implement this? Is it that you need to go to a training facility and get a certification? I don't know in Canada what that looks like. I know in the United States that we have several, and you can go there for several days and you can go through all the things and learn how to do them. There are costs obviously involved with that. I think that is probably the very best place to start because you want to have all the information in your brain. And there's a ton of physical therapy things that you can do without an underwater treadmill. You can start with, the balance balls and the weaving exercises and range of motion, maybe a TENS unit, right? All of those kinds of cool things. So I would just delve into the research if it were me, and I would just take away all the barriers, think outside the box, and just brainstorm all the things, right? And then start putting it together into a cohesive plan of what this could look like. So those SMART goals, right? Your first phase in that goal might be, how do I get the education that I need? And how do I show my hospital team the return on investment? You're going to need a place in the hospital that you can do these things. You're probably going to need no-slip mats, right? All of that is going to require an investment. So what does that look like to the hospital, and how are you going to help the hospital see the return on investment so that they will want to invest in you? Maybe you have a hospital that's already doing a lot of orthopedic type procedures. Maybe you have a lot of senior pets in your hospital, right? How are you going to affect the quality of life of the patients that you see each and every day? So that's how it would start. And then again, put that timeline in place for what that would look like, right? And so part of the research is going to be, when do they offer these classes? When can I get there? And at what point can I realistically start ordering the materials for our hospital and start seeing patients? It also takes time to get the word out, right, on getting patients in. You might only have 1 or 2 patients a week initially. And so you have to kind of figure what that schedule is going to look like. Are you just going to squeeze them in? Because they need to be able to pay you as well. And that's another expense for the hospital. So I think that's where I would start anyway. Just really delve into the research.
Perfect. And I just saw a question come in from Lisa over here, where Lisa unfortunately learned about this webinar a little bit too late, so joined us late. So Lisa, don't worry, this is recorded and we will be sharing a link to the recording after the fact. Now I know we've covered early in the career. We had a question come in from an individual who's with a corporate company and said the highest a tech can become is a lead tech, which is the role that they are currently in. So do you have recommendations for any other avenues they could look at pursuing?
Yes, it's endless and it's so exciting. That's where I would say, is this from the person that came on later?
No, actually, this is another one.
This is someone that was on. Okay. Mm-hmm. So yeah, if you go back in my talk where I had, the questions, I think that you should do some soul searching. I think you should jot those questions down and don't think about where you're at in this moment, what your hospital can offer you, because you're starting to put barriers around yourself in that moment. Think outside the box and just really think, like, in a perfect world, what would I do? I will tell you, this is a dream of mine that will probably never come true. My perfect world, I would do venipuncture and bandages all day long. And I would just be a happy technician. I would love it, right? But that's the kind of thing I'm thinking, like, what is it that you love? I love venipuncture and I absolutely love placing bandages. I love it. I love wound care. I love that, right? What are the things about your career and your day-to-day that you love? Is it the puppies and kittens? Is it surgery? Is it anesthesia? Is it dentistry? Is it geriatrics? What is it that you love? And what can you do to create a career path for yourself out of that? Again, feel free to reach out to me if you need additional, like, hey, go this direction. Hey, go that direction. I can't tell you for guarantee that this corporation that you work for will support it. But if you can show them the money, you can show them the money, chances are high that they will, right? That return on investment. And sometimes it leads us to different places, right? That's what happened with me. I ended up a couple different places, and here I am.
Well, keeping with the theme of the corporate, we did have a question come in from Nicole, actually, who's asking, what are the pros and cons of corporate versus privately owned clinics?
I'm probably not supposed to boast about VCA, but VCA is the best.
Please boast.
So I love this company. So I will tell you, I've worked for small practice. So the general practice I worked at initially was just a small practice, single doctor owned practice. Then I moved on to a private practice specialty emergency hospital, which then sold into Blue Pearl. And so I got to experience what it was like to work under Blue Pearl. I worked for Banfield for a short time, and now I work for VCA. So I've gotten the gamut of all the things, right? And what I have found, particularly with VCA, is you get all of the HR type benefits, right? We have amazing healthcare. We have amazing just benefits on that side. The other side is we're able to support our hospitals in a way that a private practice is not, right? You have someone like myself with 27 years of experience able to travel around to hospitals and help you to grow. If you don't have the resources within your own small hospital, which each of our hospitals kind of function like a private practice, but if they don't have all of what they need within that hospital, we can support them from the field level, right? And I can come in and I can provide additional training and education and on the floor help, CPR, wet labs, whatever that might be, right? And it helps us to make sure that we're doing really, really good medicine. We have, and I'm speaking from VCA because that's where I work currently. I'm not going to speak to any of the other ones, but to where I'm at now. And they have very similar structures within their field teams, but we have an amazing CMO, and she helps us to come up with really great guidelines. What are our vaccine guidelines going to look like? And what are our surgical guidelines going to look like? And what is best medicine? It really helps to make sure that we are upholding the very best possible quality medicine for our patients and our clients possible.
That does bring us to the end of the webinar here, and it looks like we've gotten through all the questions. So thank you so much, everybody, for sending in your questions. And of course, thank you to you, Angie, for an amazing presentation. And we actually have some agreeing opinions here in the chat. We have Valerie saying, I agree with Angie. I love VCA.
Val, it's my Val. I love my Val. Hi, Val. Somebody I know.
Yeah, it looks like you do have there's a consensus. So
that's great.
Thank you, of course, to you, Angie, and thank you to everybody for attending today's webinar. For anyone who is looking to continue your learning, we, of course, are very excited to share the NAVTA, the credential that we launched with NAVTA, and the Infection Prevention Leader Program, which we put the link in the chat, but of course, we'll share in the follow-up email as well. If you do have any other questions, please feel free to visit rescuedisinfectants.com and keep an eye on your inboxes because we will be sending a follow-up email with today's presentation, a link to the recording, and additional resources as well. So on behalf of Virox Animal Health and Fear Free, and of course, Angie, thank you so much for joining us today.
Thanks, all.